I'm Dr. Beltre from Beltre Bariatrics, and I'm going to make this short video regarding the vitamin B12 deficiency, especially vitamin B12 deficiency in bariatric patients. Again, I'm a bariatric surgeon in the area of Orlando, Florida, in central Florida. I specialize in, of course, in obesity surgery. Why did I choose vitamin B12 deficiency to speak about it? Well, because vitamin B12 deficiency actually turns out to be one of the most common deficiencies in bariatric patients. In fact, already 5% of the population have B12 deficiency. So about 5% of patients that are coming in to have surgery already have a B12 deficiency. And that 5% turns into 13% once they have the surgery. So it's fairly common. And therefore, I wanted to make a short video explaining how it happens, what causes it, what are the symptoms, and how to treat it. Well, why did B12 deficiency happen? Well, first of all, B12 deficiency happened because of changes in our digestive tract. That's one of the most common causes. Of course, there are diseases that can cause changes in digestive tract, like, for example, gluten sensitivity. Gluten sensitivity basically means you are allergic to certain type of foods, and this allergic reaction in the intestine causes inflammation, changes in the digestive tract in the small intestines, and therefore affecting how you absorb vitamin B12. So you can see it in patients with gluten sensitivity. Of course, in patients that are strict vegetarian. I mean, after all, the best sources of B12 are from animal products, meats and seafoods and things like that. And although there are certain plant foods that may have some B12, like almonds and things of that nature, most of the B12 really comes from animal products. So the strict vegetarian, certain type of medications like antacids, antibiotics, some types of hormones, medications used to treat seizure disorders or anticonvulsants can also cause B12 deficiency, chemotherapy, and of course, surgery. In surgery, we are altering the anatomy of the GI tract, of the gastrointestinal tract, and therefore these can over time lead to vitamin B12 deficiency. For example, in a bariatric procedure, you make a small stomach, like you do in a gastric bypass. You're bypassing the main stomach, and of course, you're bypassing part of the intestines where some of the B12 is absorbed. So therefore, of course, you can change how you absorb certain things. It's very interesting the way that the body absorbs B12. For our body to absorb B12, it needs to be coupled with a protein that is made in the stomach. This protein is called intrinsic factor. So the stomach makes a protein called intrinsic factor, which then couples with the B12. And then, of course, the B12 goes down the intestine to be absorbed in the last part of the intestine, or the terminal ileum, and then it's stored in the liver. So that's pretty much the route of vitamin B12. It comes into the stomach, mixed with intrinsic factor, and then it goes down the intestine to the last part of the intestine where it absorbs, and then, of course, the body stores it in the liver. That is the natural way that the body absorbs B12. Well, after you have a bariatric procedure like a gastric sleeve or a gastric bypass or a duodenal switch, you can see that during these procedures, first we make a smaller stomach. In the sleeve is more a long tubular stomach by removing 75-80% of the stomach, and therefore now you're eating less, right? The portion that you're eating at a time is much less. Smaller stomach in the gastric bypass, and the main stomach is bypass, and of course you also have a sleeve in the duodenal switch that is combined with bypass of the intestines. As you can see, when you're making a smaller stomach, you're making less acid. And of course, we need acid to break down the B12, and especially when you're taking a pill form, you need the acid to break it down so you can absorb it. And if you're having a smaller stomach, well, you're making less acid. Also, remember that in the stomach is where the special protein is made, the intrinsic factor that helps you absorb the B12. And because you have a smaller stomach, then we can make the argument, well, you're probably making a less intrinsic factor. And as a result of this, it can lead to less absorption. And then, of course, in a bypass and a duodenal switch, you are bypassing part of the intestine where certain things are absorbed, especially in a duodenal switch where you're bypassing 50% of the intestines. Of course, it's going to affect how you absorb certain vitamins, including vitamin B12. So this is how you can become B12 deficient after a bariatric procedure. smaller stomach, you're eating less, making less acid to break down the B12. Then, of course, you are making less intrinsic factor. And then on top of that, in certain procedures, you're absorbing less because the intestines is bypassed, and therefore you can lead to B12 deficiencies. Well, what are the symptoms of B12 deficiency? Remember, B12, our body uses B12 to make red blood cells. Also, in addition to the red blood cells, the cells of the immune system, and also, of course, the replication of the cells in our nervous system. And therefore, the symptoms of B12 deficiency have to do with our immune system, red blood cells, and of course the nerve cell. What are the symptoms of this B12 deficiency? There can be things like anemia. Anemia, of course, can lead to tiredness or lack of energy, heart palpitations, your heart start beating faster, shortness of breath, especially when you just walking, lightheadedness, of course, a loss of appetite, a weak immune system, which can lead to easily getting sick or developing some type of infection because your immune system is not working the way it should. Low platelet count, and this low platelet count, of course, can lead to easy bruising, where you just hit yourself at the edge of the table and you can easily bruise. That's usually mean your platelets are not working well, and that can be a symptom of a B12 deficiency. There's numbness and tingling of the nerves, especially the tip of the fingers, the tip of the toes, can give you this numbing and tingling as a result of B12 deficiency affecting the nerves. Glossitis is inflammation of the tongue. Red tongue or inflamed tongue, that is from B12 deficiency. Of course, can affect our vision or vision loss, memory loss because it has to do with the nervous system, and depression. Those are some of the most common symptoms of a B12 deficiency. Well, that's great. What are the sources of vitamin B12? The best sources of vitamin B12 are from animal products, so especially seafood. So some of the best sources would be things like clams, oysters, fish like salmon, meat, red meat, beef liver. Remember, I said that the B12 is stored in our liver, right, including animals' liver. So therefore, when you consume beef liver, it is very, very high in B12. It's probably one of the highest sources of B12. Poultry or chicken, eggs, of course, milk and milk products like milk itself or cheese. Those are the main sources of B12. Like I said before, there are some plant products that can have B12, like almonds and things like that, but it doesn't compare with the amount that you will find in the animal products. Well, what is the recommended dose and how do you treat a B12 deficiency? The recommended dose of daily for B12 is 500 micrograms daily. And there's different ways that you can take your B12. You can take it in a pill form, of course, which is the most common. You can take it nasally with a spray that you can do once a month. When it's a pill form by mouth, you do it once a day, of course. When you are taking it nasally through the nose, a nasal spray, it is once a week. Or you can do a monthly intramuscular shot. My patients have different preference. Most of my patients, I would say, take it by mouth through the multivitamin. And then the other have probably do an intramuscular injection once a month. Very rare do I come across a patient that takes it nasally. The nasal route doesn't seem to be very popular among the bariatric patients anyway. How do you treat deficiency? Well, somebody becomes deficient, you double up the dose. You take 1,000 micrograms daily. And again, you can take your B12 either by mouth, or you can take it nasally, or intramuscular injection once a month, but once at 1,000 micrograms daily. Once your B12 becomes normalized, then you go back to taking your 500 micrograms daily. Very important. Because believe it or not, it takes time for you to develop a B12 deficiency. It can take years, sometimes 2 to 5 years to become deficient. Remember that our body stores B12 in the liver and so on and other tissues. So therefore, it takes time for you to become deficient. And as a result of that, some patients don't take the multivitamin because they feel fine. They don't take the B12. I'm doing great. I'm doing fine. And it takes time. And eventually, they can get in trouble with B12 deficiency. It's very important that you take it because you might not notice any changes, any deficiency until years and years later. So important to take your bariatric multivitamin. I normally recommend a bariatric multivitamin that has enough of the B12. You take it once a day. Most of the bariatric multivitamin these days are formulated that you can take it once a day, and it works fine. You just find one that you like. They all have different routes or different modes of application. Some are chewable, some you just take a pill that you swallow, some come in a powder form that you mix with your juice and your water and things like that. You just find one that you like, taste-wise and things like that, and take your multivitamin. So important. Every bariatric patient, whether you had a gastric sleeve, a gastric bypass, or duodenal switch, that you take your daily recommended dose of your vitamins, which will include vitamin B12. Well, thank you for listening to this short video. I hope this video was of help to those that are thinking of having surgery, those that already have surgery. Again, I'm Dr. Beltry from Beltry Bariatrics. Thank you for your time, for your attention, and I will see you in the next video. Thank you.